Hey, this is Dr. Lance Hamilton coming to you from Jolie Vie Aesthetics. I would like to talk to you today about female sexual dysfunction. That's a general term which basically has to do with the entire process of a female going from the state of non-arousal all the way to orgasm. Studies have shown that 40% of females worldwide suffer from some type of sexual dysfunction. There are many different types, and so each of those types has their own separate treatment. The first type has to deal with psychology. There are females, of course, who have been abused in the past, sexually abused by either family members or others, and they suffer basically from PTSD. And this keeps them from being able to engage in sexual intercourse no matter what, because of the psychological effect that they have had from this previous trauma. And of course, that is treated with psychiatric and psychological help. We have another problem where people are raised and taught that sex is something that's not good, or that it's dirty, or that it's not to be done, and so they carry a lot of so-called hang-ups about it, and then when they get married they can't have a normal sex life with their husband. Well, that's a big problem. Kids are taught in many different cultures not to have sex until they get married. The majority of them do it anyway, but the ones that do remain celibate until they get married, they sometimes have a big problem having sex because it has been ingrained in their minds to not do it. And so the female can't go from an aroused state, from a non-aroused state to an aroused state, and therefore they never enjoy sex. That has a very negative impact on the marriage, obviously. And the way that is overcome is also with psychological treatment to help the female overcome this inhibition from enjoying sexual intercourse. There is another type of sexual dysfunction in females that involves aging. And it has to do with not just females after menopause, but some females before menopause, especially females who've had multiple children. The pelvic floor starts to lose the thickness and vascularity and nerve function that it had when they were young, and so they no longer feel sex the way they did before. And so during sexual intercourse, it is hard for them to ever reach an orgasm because they simply can't feel like they did before. And that again is a real problem because it makes them feel bad because not only are they not able to have an orgasm and enjoy sex, but they feel bad because they're making their partner feel bad, that the partner can't help them reach orgasm. And so you can see how that would really affect a marriage. Well, in the past, we've never had any way of dealing with this. The psychological treatments won't deal with it because it's a physiologic problem having to do with blood supply and nerve tissue and function of the pelvic floor. I know you've heard of people doing Kegel exercises to try to help their urinary incontinence and also help their female sexual response. But all that does is exercise muscle. It doesn't stimulate new tissue to come in and bring in new blood flow. So there is no surgical treatment at the present time to treat this problem. And so up until now, there's never been any way to treat it. And it accounts for 10 to 20% of females over the age of 30. And in females over the age of menopause, it can be up to 50%. So, there has been a new procedure developed by the same physician that developed the vampire facelift, and it's called the O-shot. It utilizes platelet-rich plasma, which is simply blood taken from you that is spun down in a tube and separated into two components. One component is red blood cells and white blood cells, and the other component is your own plasma and platelets. The platelets that are in the plasma are the parts of your blood that help you to clot. Those little platelets, those little speckles of material in your blood, also are very important for sending out chemical signals to stem cells to come in and generate new tissue. That's what they do for a living. When you cut yourself or skin your knee, they come in and generate new tissue to fill the hole. So what we do is we take this platelet-rich plasma and we inject it back into the female in an area between the bottom of the urethra, which is your bladder opening, and the top of the vagina, so that we can start building new tissue in the area between the urethra, which is the tube from your bladder into your opening to your bladder at your vagina, and the front part of the vaginal wall. The procedure involves you being anesthetized with a numbing cream, and then again a small injection of lidocaine is performed to give more anesthesia to that area, and then a single milliliter of this platelet-rich plasma is injected into the clitoris, and this platelet-rich plasma starts calling up your stem cells to come in and regenerate new blood flow into the clitoris. Most people don't know that the clitoral organ itself, the majority of it in females, is inside them. It can't be seen. And so this platelet-rich plasma that we put in starts to generate new blood flow to the clitoris and cause it to get bigger and to get more sensation. And with more blood flow and more sensation comes more nerve tissue, which can help the clitoris become more sensitive, therefore helping you possibly reach orgasm during sex. The other injection that we do is below the urethral opening and the top of your vagina, where we put in about 3 or 4 milliliters of this platelet-rich plasma into that space. That space is an area that's vital for females because it's been shown that that general area is the most erotic sensitive area in the female vagina. I know you've heard of people talk about the G-spot, but the G-spot migrates in most female vaginas based upon their mood and body position. The so-called O-spot is a more generalized area that essentially is the front part of your vagina just underneath your urethra. And so when you put this platelet-rich plasma in that area, it starts to generate new blood flow. It starts calling up new tissue, and it calls up new nerve fibers. And so you can see how that would make that area of a female body more sensitive, like it was when you were young, to respond sexually during intercourse. So, to summarize, for females who aren't suffering from some type of a psychological problem with sexual function, but it's a physical problem, we have a way to treat it that we've never had before. They've never had any pills that would do it, and they've tried creams and hormones, and it just doesn't do it because it's not solving the essential problem, which is a thinning of the pelvic floor, and not just the muscles, but the pelvic fibrous tissues and the blood and the nervous tissue that is essential for a female to be stimulated enough to reach orgasm. If you would like to learn more about the O-shot, which is the procedure I'm talking about, you can either click on the link that's here on our website and go to Dr. Runnell's website, He's the inventor of this. And he has more videos and more information that you can read about and watch. Or you can schedule an appointment and come in to talk to me. And we will sit down, and as a part of the workup, before we ever even do the procedure, we will go through all the possible causes of your sexual dysfunction. And if I find that it's a psychological problem, I will encourage you to get that taken care of first before we try the O shot. I won't just encourage you to get the O shot just for my benefit. I want you to have better sex, but I want you to have the proper treatment. If we find that it's not a psychological problem and that it is truly a physiological problem, a true physical anatomical problem, then the O shot has about an 80% chance of improving your ability to reach orgasm. So either click the link and go get more material off of Dr. Ronald's site, or come in and we will have books to hand to you that you can read through, or you can come in for a consultation. I'll talk to you about it. But if you are suffering, you don't need to anymore, because we have something new now that we never had before. So get in contact with me and I will try to help you. Thank you.